Before we get into today's show, I want to tell you about a new offering from MD Coaches. Group coaching for physicians is a small, virtual, confidential cohort designed to inspire participants to rediscover personal and professional fulfillment. The next cohort begins on Thursday, October 6th, and runs weekly until November 10th. And you can earn 1 CME credit per session, totaling 6 credits in all. To learn more and to register, visit www.mdcoaches.store. Space is limited, so be sure and register today.
This year, what NRMP reports is that there was 11,600 something applicants that did not get into residency.
Paging Dr. Cook. Paging Dr. Cook. Dr. Cook, you're wanted in the OR. Dr. Cook, you're wanted in the OR.
Welcome to the Prescription for Success podcast with your host, Dr. Randy Cook.
Hello, everyone, and welcome to Prescription for Success. I'm Dr. Randy Cook, your host for the podcast, which is a production of MD Coaches, providing leadership and executive coaching for physicians by physicians to overcome burnout, transition your career, develop as a leader, or whatever your goal might be. Visit MD Coaches on the web at mymdcoaches.com because you're not in this alone. And don't forget, CME credit is available when you listen with us. Just look for CMFI in the show notes to learn how. Well, I have a pair of guests on the podcast today. Both of them have had very personal experiences with that frequently excruciating experience of finding a residency in the U.S. If you've been through it, you know how unnerving it can be. It's what we call very simply the match. Dr. Mohamed Khalif and Dr. Henna Sawhney joined me to share their personal experiences. So let's hear that conversation. I'm really excited about today's interview. I'm talking to a couple of really interesting people about what I think is probably the most significant issue facing all medical graduates who intend to practice in the U.S. Without question, and the difficulties that we've had in getting that selection process straightened out. So today we have Dr. Henna Sawhney, who's coming to us from, I believe, the San Francisco Bay Area. Am I guessing correctly on that, Henna?
Yes, you are.
Oh, man, how nice that I got it right. And Dr. Mohamed Khalif in the Seattle-Tacoma area. Did I get it right again?
Yep, that's right.
Lucky me. All right. And these two people, fortunately for all U.S. medical graduates, have had the great wisdom to try to do something about the medical student residency matching program. And we're going to talk about that in some detail. But to begin with, Henna and Mohamed, we like to learn a little bit about everybody's origin story. So, Henna, tell us, at about what period in your life did you begin to think you might want a career in medicine?
So I would say quite young. I was about 10 years old. I was very interested in, biological sciences, and I had this teacher in 6th grade that one of our biology topics was the signs of cancer. And that's what really, it sounds morbid, but I was just very interested in the diagnosis of it. And the reason is because I've actually had a lot of people very close to me, including my grandmother and an aunt that had cancer and passed away from it. And for me, medicine wasn't just about, learning science and getting rich or, having that respect. For me, it was allowing me to bring two things that I love, is serving others and the sciences, and putting it together and making a difference at the individual level. You can be interested in lab work. You can do the same thing in many different ways. But it was really the human aspect of medicine and its relation to the sciences that really drew me to it.
I can't think of any better motivation than that. But the really interesting thing, and I think I've got this right, you actually grew up in this country, but you got your medical education in the UK, right?
Yes.
How did that come about?
So I've had an interest in global medicine. Growing up here, I actually stayed in the Bay Area my entire life until medical school. Grew up here in the East Bay as well as in San Francisco, and then went to Berkeley for undergrad. And while I was at Berkeley, I decided to do something unconventional, such as going into a women's studies major instead of doing my pre-medical majors like biological science or chemistry that most people do.
That is unusual.
Yeah. And the reason was one of my high school teachers, she had gone to Berkeley, and she said the best course she ever took was in women's studies. And it was an easy way to clear off a general education course. So I took one and I loved it. And I took another, and it was all for gen ed. And I realized I could make a major out of it. And it was interesting to learn about privilege and how that relates to society, and how political things can be personal and people make personal things political. And it really drew me to it. And when I was always interested in studying abroad. And at the time I was in college, globalization was just starting, and people were starting to think outside of just the United States. And so I thought it would be really interesting to learn about medicine outside, because the teaching is the same, because you're learning the same diagnostic criterias, you're learning how to treat patients, but the approach is very different in every country.
The science is always the same.
The approach
the society is completely different, right?
Exactly. And so I took a leap of faith and decided to go to the UK. And this particular program was an international program. So my classmates came from all over the world, Asia, Europe, Australia. Some were a few were even in Palestine and Syria and had just narrowly escaped what was going on there. And Canadian as well. And just hearing how medicine was practiced and the differences between their country and what we did in the US was very eye-opening. And I think by far the best experience I ever had.
That had to have been quite an experience.
And it was. And the UK, I think this also really showed me the flaws when I came back to the US in our system, especially in education and training and parts of practice. I think because I had this exposure of how it's different outside, I had more of a cultural shock coming back home and saying, well, why are we doing it this way when there is a better way that other countries are doing it? And I think that really has pushed me in a lot of ways to find innovative processes and other options, rather than sticking to what is the main, what is the norm of society. So with residency, I pursued it actively for many years. And I always got feedback that, you'll get in, you'll make a great doctor, you have a sound education. And I like even working when I was in Missouri, which we can speak about later, being able to practice there, I got the same feedback. But the problem wasn't my capability as an individual physician. The problem was breaking through the system that we have established and being given a chance to do what I've been trained for.
All right, I'm gonna hold you right there, and I'm gonna see if I can bring you both to the same point, which I think is going to be pretty easy. But I'm going to go to you, Mohamed. Now, Henna actually had a somewhat different approach to medical education as compared to what we usually do in the U.S. But you certainly did, and I think perhaps in a much more convoluted fashion as well. So tell us about your decision to get into medicine and where you got your education.
And I was born in the 1990, right after the Civil War in Somalia, just immediately after the Civil War in Somalia. And my parents, fled the country because there was a huge conflict there, and it was very brutal. And we had to, flee to the neighboring Kenya for almost, I would say, 2 years till 1992. We were fortunate enough to, immigrate here to the United States. So I came to this country when I was 2 years old. Started doing my early year, daycare, elementary school here, and just kind of like coming to a new country. It was I vividly remember like that transition for my parents was very hard because of that trauma, and some of the things they had to go through there. Just hearing the stories sometimes of all of the bullets they missed and how fortunate they were to find safety was just a really remarkable story from them. So early in my childhood, I remember, in elementary school, my teachers used to ask me here in Seattle, what do you want to be when you grow up? I always used to say I want to be a doctor. I used to dress up as a doctor during Halloween. Yeah.
Very, very early in your childhood.
Very early in my childhood. It's something that I just always wanted to do. And I think
well, now, did you get that from television doctors or your family doctor? Where did that come from?
So I think that became, when newly arrived immigrants come through, they go through a lot of medical screenings, and they often, and plus I had some, conditions as well. I had, tuberculosis, and, I had to go to the doctors most frequently. And I think being around, pediatricians and, international medicine clinics just put that spark in me. And after that, my father started a business, and, he started a business because he realized that most of the immigrant community here in Seattle did not have some of the things that they used to have back home. So whether it's like clothing or decorations or other products that they used to enjoy, they couldn't find it here anymore. So he started a business with some other colleagues of his, and after that, we were just on the road. I did from middle school all the way to medical school. I did it in other countries. So I was in Amsterdam, I was in Pakistan, I was in China, I was in Dubai, I was in Kenya. So I lived in 5 different countries and did school in all those different countries. Eventually, I did my high school and medical school in China because that's where most of the manufacturing was happening, and my dad was living the most at that time.
So you never really saw very much of the U.S. educational system at any level. Is that what I'm hearing?
Only elementary school. I did all the way to elementary school here, but from middle school to medical school, I was around the world. Okay.
All right. We'll pick up the story again.
Yeah. And after that, I just, when I came back, my dad lost his business, unfortunately, in 2008 because of the recession. And, when I came back here after medical school, he drove a cab after he lost his business, tried to get me out of medical school in China. He was here. And when I came back, it was a total different story for me because, then I had to go through the challenges that I think we'll talk about later, of trying to get into residency and try to get into the match. And it was a very different, experience for me. But in short, that was my experience on, how I became a doctor and then what's sparked that interest.
Anywhere along the way, did you think, well, gee, I made a mistake, or were you still pretty well motivated?
No, I was very motivated. Very motivated. I had my eye on the target. This is something that I always wanted to do, and this is something that I always spoke about as a child. And I had huge support from my family because of that, because they knew this is what I wanted to do, and they were supporting me throughout the time. And I never thought for a second that I wanted to change a career.
So we've gotten medical school done for the both of you, and we got to talk about the really next big step, and that is that both of you had to face the infamous matching program. And Henna, I'm going to go back to you. Tell us about your experiences with that.
I graduated in 2018, and I had just moved back home to the Bay Area from Chicago. Finished, the USMLEs, was gearing up for residency match. And I was working at UCSF at the time as a clinical research coordinator, because the feedback I had gotten at that time was, even though I'm born and raised American, my parents are immigrants, so I faced, the balancing of two cultures, but my entire life has been in the U.S. And then coming from a foreign medical school, they said, even though you are American, you will have some setbacks as someone with a foreign degree. And so I was doing research because they said that getting some publications and, staying clinically involved to some degree would help get into residency. So I started the application process, had my LORs, everything ready to go. And I didn't get any interviews the first 2 years I applied, actually. The feedback was maybe I wasn't applying everywhere. The number of programs I wasn't applying wasn't enough, or it wasn't focused. I got a lot of feedback, and there was always something that I was told wasn't enough from my end as an applicant. And just to give you some numbers, I applied to over 400 programs across the country every year I've applied, except this last year. Cost-wise, that's up to about $10,000 a year that I have saved. Luckily, I have the support of my parents and my family, and I was able to stay at home and didn't have to worry about, living costs because of them. So whatever money I had made, as a research coordinator went directly into the match process, because that was my personal investment into my future. And the first 2 years, I always found a reason that I didn't get in. My scores weren't high enough. I didn't have enough research experience. I didn't do enough clinical rotations. But even though I went to a foreign medical school, my third and fourth year medical school rotations were actually here in Chicago. I had clinical rotations prior to that in Cyprus, where my first 2 years were located, since we were in an international program. But the core clinical rotations were all in the U.S. So there was no gap in terms of trying to understand how the medical system worked in the U.S. And all my LOR all the doctors that wrote me a letter of recommendation were U.S. doctors. But I wasn't getting through whatever filters there were for these programs the first 2 years. The third year I applied, I got one interview, and it was in the middle of the pandemic, and it was sheer dumb luck, to be honest. I had gone on this rant on Twitter, and that's actually how Mohamed and I were connected to found our nonprofit. And this program director just happened to have been on Twitter, and he reached out to me and he asked, "Why haven't you matched?" And I started speaking to this program director, and luckily it was just after match and prior to the new season. And after reviewing my application and seeing how dedicated I was, they said they would consider me for an interview for a residency. And they did interview me. It was the first time I got an interview for a residency. And so I was very excited, but I also had gone through it twice, knowing what can happen and how you can't have your hopes too high because the fall is much worse. So the interview went well. I wasn't expecting anything. I was keeping my hope. I was hopeful more than previous years, but I was just trying to be realistic as well. And so I didn't match. And that year, my mom was the most devastated. She has been my support and rock through all of this. Like, she's told me many times, like, is it worth the emotional and mental distress you've put yourself through all these years? And I keep saying, yes, it is. And she says, okay, then I'll support you. And so seeing how it affected her after match, that I didn't get it, really brought it to perspective to me. Like, is this worth doing it anymore? And it's not about, is it worth to practice medicine, but is it the process we have created in this country worth the struggle to be able to practice medicine? And so after that year, I got feedback from the program director. He said, funnily enough, that the other faculty had said that I had too much research on my application, and it was too much research focused. And so at that moment, I kind of shifted my perspective on residency. I was like, this is not the end all be all that I've been putting it for the past couple of years. I moved out to Missouri to practice medicine with the license that they give, the assistant physician license. I also got a job as I work with the CDC and have been working on their COVID teams at the San Francisco quarantine station. And I kind of left research because although it was interesting and I liked it, it wasn't what I was pursuing as a career. It was always going to be a stepping stone.
I understand.
No, not at all. The experience is great, and I've utilized it, and I will continue to utilize it and possibly see another career option, but it wasn't what I wanted to do. And so last year was the last time I applied for residency. And I remember the application had just opened and we had to pay the fee for it and the registration fee. And the day I applied for that and paid it, after that for almost like 3 weeks, I just laid in bed. Other than going to the urgent care clinic or the volunteer things I was doing, I was just in bed because I was just so distraught from the process. And I was actually having a traumatic response to it. And so I was like, this is the last time. I'll put all my effort into this. And then after that, if I get into residency, that's great. But if I don't, it's just not worth the struggle anymore for me. I was fortunate enough for my friends to advocate for me in the last cycle. So I got 2 interviews, but unfortunately it was the same thing. I just didn't match. And for whatever reason, and it's a numbers game. And a lot of our colleagues, they've applied 4 or 5 times, and some of them have gotten consistent interviews every year. And the year they matched, they happen to have gotten maybe only 1 interview, or it was with the program they didn't even think they had a chance with. So there's no real, checklist you can fill to say this is the type of applicant that will get in, especially for people with foreign degrees, whether you're U.S. born or like with Mohamed have traveled the world and had different experiences, or if you're an immigrant into the country. So for me now, residency is not something I'm pursuing, and it's not because I've given up on being a physician. It's because the process of becoming a physician is too toxic at this point.
And, my recollection is, I think they actually officially, pardon me, put the match system into place in the early 50s, like 1952, and they've tweaked it every single year since that time. But clearly, there are some additional problems. And so, Mohamed, I'm going to go back to you. Tell us about your experience with the match, just to show us how many ways it could go badly.
Yeah. So I graduated in medical school in the end of 2014. I came back here into the United States. By that time, my family was in a very difficult spot financially because, my dad was driving a cab to try to get me out of medical school after he lost the business. There was a lot of financial problems. My mom was sick as well. And I just really had to, not only, finish the prerequisites that are required to enter the match, which is the USMLE exam. I had to study for those because in China, when I did my medical school there, I had to prepare their boards and I didn't have the time, to prepare the USMLE to, to get the process faster. So I had to, first of all, I had to find a job because I didn't have no money to pay $1,000 for the test because that's how much, that would cost me to do the test for each test. So I needed some money. So I was looking for jobs. So that was the first thing that I did. And I applied everywhere. I applied to every clinic, every hospital. And even the regular jobs was very difficult for me because everybody was like, hey, you're a doctor, you're overqualified. We're not going to give you this job. And it was really difficult. And, and somebody else just, recommended, hey, just remove the doctor, degree from your resume. And I think that will make it difficult for you to get a job. And once I removed that, everybody was like, well, you don't have no education.
Oh, no.
So it was a catch-22, a really difficult process for me. And so I had to, eventually to make ends meet, I had to work in a lot of odd jobs. So I worked as a security guard. I worked at a pie factory, cooking pie. I did a lot of things just so I could make some money to prepare and take the tests. Eventually I was able to save up some money, take my tests, pass my tests. And, I was ready to apply for the residency match in, 2017. And after that, I think so. I didn't have enough money because, everybody tells, especially if you're, graduated from an international school, you have to apply really, really broadly because it's very difficult. So I had to, sell a lot of things. I had to borrow. So I invested $10,000 in the first year, and tried to apply it as wide as well. I always wanted to be a primary care physician. I wanted to be a family doc. So that's where I applied, no other specialties. And just applied very broadly the first year. And I got 0 interviews. It was a very devastating, experience for me, putting all that, money and, energy and time with the tests and everything. It was very difficult. So what I did was I tried again the next year. And the next year I applied to multiple different specialties, because I thought maybe, because I applied to one specialty, maybe that was the problem I didn't get in. And I went on LinkedIn. I made some connections, with the local hospitals here. I spoke with some program directors. And the next year I was fortunate enough to get one interview from the University of Washington UW Family Medicine here, in Seattle. And I was really excited and stoked because that was the first interview that I got to in the residency process. But that was just one interview out of the 500 I applied to. And it was, and I knew that, my odds were very less, but I was still very hopeful because I thought, what, if this was the system that I came to in this country when I was an immigrant, child, and, the doctors here were the doctors who inspired me to become a physician. I have history here. I didn't know the community really well. And I thought that I would be very competitive. But, unfortunately, when match day came, I did not get in, and I asked, feedback for the program, and the program's response was that we just had so many applicants, and it was very difficult for us to make a decision. So, and I think they got these days, each family medicine program gets 3,000 applications for eight spots, because of the way the applications in the medical schools are rising compared to the applicants. And
I didn't realize it was that competitive.
Yeah, right now it is very competitive. And each program directors, that I spoke with and saying, hey, I have, people, one program director I spoke with told me, hey, I have people who are doing rotations here. I have, people who are coming from away rotations. I have thousands, and we don't even review every application, right? We have a filtering process. If you're under 250 or 240, we're not going to get the chance to even review your application. So I'm really happy right now they made step one pass fail, because I think, if that was in place, when I was applying, maybe I would have more, better chances, because I think, that puts a lot of stress on a lot of people, and that will force a lot of programs to review more applications and do a more holistic review as well. So a lot of people don't get filtered out. But I think the biggest problem that I faced is the nine times out of 10, if I reached out to somebody, if I were able to speak with the program director, and I was able to tell them about my story, Henna described, and I did. I mean, if you get lucky that way, it's easier to get an interview. But but applying, it's really hard, and there's so many program directors that you can get a hold of. So that was my challenge in the match.
So it comes as no surprise to me that things have changed. I entered the match back in the days when the earth was starting to cool. And it was my understanding that there were quite a number of residency slots that went unfilled in those days. And it was actually my impression that there are still unfilled residency spots even today. But it sounds as if the spots that are not available are those in primary care. And I'll put that question out for the two of you. What do you guys think about that?
Yeah. So basically, there's two processes, and I've seen this, conversation for a while, and then I think so Henna can jump in. Basically, there's two processes. There's the SOAP system, right? And there's, the scramble system after the SOAP. But, a lot of people don't understand that the applicants who end up applying for those scramble and SOAP system after the match, those quote unquote leftover spots, are still very minimal compared to the thousands of people that are competing for a left-off spot. So, and Henna, maybe you can add to that.
Yeah. So having come for doing research for 3 years, I've approached this issue with data, because I think that's the best way to really open people's eyes about this. So just going back into a little bit of history of this. So Dr. Cook, when you were applying for residency, there were ample spots there for everyone. It was just a matter of finding it. Whether you were, a medical student here in the U.S., an immigrant into the U.S., or someone that had never set foot in the U.S. and was trying to come in and practice here. But in 92, I believe, it was 92 or 96.
97.
I think it was 96, actually.
Yeah.
It's 97. Thank you, Mohamed. So 1997, a cap was put on the number of residency spots because of this fear that there would be too many doctors.
Oh, you can't be serious.
And what that has done. Sorry?
To coin a phrase from, I can't even remember which comedian said it all the time, but what I said was, you can't be serious.
Oh, yes. Yeah. That was that was the perception, that we would be having too many physicians in the workforce and not enough people to treat and not enough jobs for those physicians. And so that's why that cap was made by the Balanced Budget Act. And since then,
so
it has been an
Washington.
uphill battle.
Now it makes sense.
Yes, it's a federal. And so since then, there's been an uphill battle to increase or lift this cap. Especially now that we have a physician shortage. And so what has been happening and I think has been heightened maybe in the last 5 to 10 years, is that our residency system is built a little differently than other countries. We are an open market in terms of who can apply. If you go to Canada, they have a tiered system where they give preference to Canadian medical graduates and then Canadian citizens, and then whatever's left over after goes to anyone. In the UK, with me as as someone who holds a UK degree, I could have gone to the UK and practice. Unfortunately, my situation was a little different because the year I graduated was Brexit, and at that time they were not giving any visas. So they were only, you had to have a UK degree, but you also had to either be a EU citizen, a citizen of the Commonwealth, or citizen of the UK to be able to get into their training programs. So for me, my option was to come back. And when I came here, I realized that, we don't just have US medical graduates applying for this. So we have the fourth year medical students in the US that are applying. Then we have graduates that might have taken a research year or didn't match the previous year that are applying. Then you have immigrants. These are people that have completed their degree, maybe even training in a foreign country, and have immigrated into the country and either are on green card or even citizens that are applying. Then you have people like me that are born and bred in the US and decided to go abroad for an education and coming back. And then there's another group of people that have never even maybe set foot in the US that are applying for visas to come into our residency training. And so what ends up happening is you have this huge pool of applicants, but not enough spots for all of those people. And there's no tiered system either like Canada or other countries where there's a preference. There's a, unspoken rule that U.S. medical graduates, so people that have attended U.S. medical schools get preference. And that's true because 98 to 99% of those students will match unless they have something like there's something really bad on their application. But nowadays you even see that it's not even because they have red flags or weren't doing well in medical school. You're getting highly qualified applicants, even from U.S. medical schools.
I was just speaking with another guy in Utah. So he graduated from Utah Medical School, and he's working with Dr. Mary Tipton, Henna. So he's doing associate physician because then, and I think so he had 240, 250 scores, but he said basically he was applying to Utah and he wanted to get into the West Coast area. So, and it was very difficult for him to even get an interview in that process. So, yeah, it's challenging regardless of where you graduate from medical school because of the overwhelming competition.
Yeah, and numbers wise, so I think a colleague of mine, Farina Khan, so she's also a co-founder of our nonprofit and matched into residency in the previous cycle and just started her PGY2 in family medicine. But we were looking into the numbers again, and this year, what NRMP reports is that there was 11,600 something applicants that did not get into residency. So out of 46,000 applicants. And so that's about 25% of applicants don't get into residency. However, that's actually an understatement of the actual number because the way they calculate it is number of positions available and the number of active applicants. And the way they say active applicant is someone that has submitted a rank list or ranked at least one program on their rank list for residency. So this astonished me because someone like me, my first 2 years, I applied for residency when I didn't get any interviews and had no rank list. I wasn't considered in that unmatched pool because according to NRMP, I wasn't an active applicant. No, same with Mohamed and several of our other colleagues and a lot of other people I met. So when we did the calculation and brought in the numbers of all applicants, including those that did not have a rank list, it actually comes out to about 13,600 something applicants that did not get into residency in this last cycle. So the 2021 to 2022 cycle. Out of 46, and then there's a lot of people that may have withdrawn their application but had submitted it, or they ended up being ineligible for residency for some reason for this cycle. So the unmatched rate is 25% consistently, and if you do the 13,000 number, it's actually 29%. So it's actually almost a third of applicants will not get into
really
residency.
Some demoralizing numbers.
Yeah, and it's just getting worse.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians, for physicians, to showcase the intersection between clinical and non-clinical interests, whether it's writing, painting, cooking, politics, and dozens of other topics. Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview. Go ahead and tell us a little bit about the ASP and what their goals really are.
So when I was, going off the last conversation, after being unsuccessful at UW and not getting into residency, with that one interview I had, I went out to different, nonprofits, and I spoke with different nonprofits in the community, and I talked to them about this issue, that, hey, I'm a physician, and, I can't get into residency for some reason. I just asked for their advice. Back then, I don't know why I even went to them. I just wanted to get some more information and have people to talk to. And they found this interesting, and they told me about, hey, do you have any data on how many people in Washington State have this similar issue? So I started a social media page on Facebook, and I started a WhatsApp group, and I just posted some posts about, is there anybody in the same situation that I am? And I spoke with different people, and I told, hey, if you ever see a physician that's not able to get into residency here, definitely, have them reach out to me. It was really astonishing because the first day we had I think so one person joined the group. And then the next week we had 2 people. And then the third week we had 40 people. And then it just went up and up and then up. And by the end of the year, that year in 2019, we got to almost 600 people on that, Facebook group, and WhatsApp group living in Washington State that were having the same similar issue. I went back to the nonprofit and they asked me as a follow-up, hey, did you get anybody? And I said, yes, I found 600 people. And they were, and they were really shocked. They were like 600 people, 600 physicians, that have, finished all the tests and everything and not able to get into residency. I'm like, yes, they're all here. And, so they didn't believe me. So we did a meeting at a hall that our local library kind of rents out. So we did that and we got all 600 people in that meeting. And it was mind blowing. We even had the local, senator and representative come to the meeting and we talked about the issue. We saw the problem, and that's how I got into, lobbying and legislative work. And soon after that, we created a nonprofit called the Washington Academy for International Medical Graduates, which, back then I thought the only problem, that this problem only affected international medical graduates living in Washington State for some reason. But boy, was I wrong, because, a lot of those people that I, figured out later were actually U.S. medical graduates from local schools and, people who graduated from other states having similar issues. And then we started doing a lot of legislative work. We worked with our state to create a program that would create a path to residency process, which is a license where people could practice for 4 years until they get a residency. Right now, we found almost 20 people are working with the test, working with this license. And the reason it's so low is because we're having a lot of back and forths with insurance companies and reimbursement and billings. But this year we were able to have a lot of success on that. So we're able to get a lot of people into this program right now. And during this time and about understanding this issue and understanding the people involved, I just went on Twitter and I saw a lot of posts, 20 posts from this girl named Henna. So
she must have been fairly popular.
Yeah.
I was really upset. I think that's what it was.
So I just emailed, hey, I just messaged her on Twitter. Hey, I said, do you want to get together? Cause I have this group in Washington and I'm trying to, bring in a larger national group to create a national nonprofit that could work on these issues. And she was very excited. And that's how I met Henna. And we reached out to a lot of other medical graduates, and soon we found the first cohort of ASP was Henna. Was it 8 people?
9 of us. 9 of us. Yes.
9 of us. And then that's how ASP was born. And, we then basically, got into a lot of movements. We got into the Free to Care movement. We got together with a lot of other physicians in different states. We worked with the NAP community in Missouri, and we just basically grew from there. And I think Henna can add more of her perspective on those times.
Yeah, and I think so. The reason I was on Twitter is I actually my supervisor at the time at UCSF, where I was doing research, had mentioned that if you Twitter is a really good place to engage with other physicians and kind of brand yourself as a physician. And so they had said that if you make a professional Twitter account, we'll tag you in our projects or when we go to conferences or other things like that, like our publications. And then you can connect with other doctors and hopefully that'll get you into the networking through social media for residency. I was not active on Twitter prior to that, so I just gave it a shot. And then I didn't match into residency and went on this rant about my frustrations it was cathartic. And it was nice to see that there was a lot of support. But the most surprising thing wasn't just the support from other physicians, was actually all these other people saying, I'm in the same boat as you. And then that's how Mohamed and our other colleagues and I, we met virtually through that and created ASP. As I started looking more into it, and all of us started trying to understand what is the problem, we realized this is not just a problem of the bottleneck of residency, but there are problems for pre-meds and medical students, and then those in residency have issues. And then when we started talking to practicing physicians, and they're like, it doesn't end once you get residency. Like, that these problems, it's a systemic problem that starts from trying to get into the medical system as a pre-medical student all the way through practicing medicine. So we started off advocating for those that were unmatched, like Mohamed said, these licenses that are in certain states, like the one Mohamed has, and his group has promoted and implemented in Washington, a similar license in Arizona and Missouri and Utah. And we found out there's been a license similar to this in Florida since the 80s. So we, this license to license unmatched medical graduates, so those that haven't completed residency, so they can practice under supervision. That's the license I'm speaking of. That's called an assistant physician license in Missouri, and associate physician license in Utah, and I think Arkansas as well.
Doctor once said that first it's trying to get into the medical system, and then it's trying to survive in it.
Yes. And that's what we've noticed. And the problems are getting worse every year. Like, I've connected with some medical students, and I was blinded to this because I went to a UK medical school, but they're all so focused on their scores for the USMLEs. They don't think about learning medicine and like the art of medicine and the practice of medicine. They're learning it so they can get the highest score in the test. And when I saw that, I was really, really disappointed, because you lose out on so much of that learning when you're just focusing on how to get that number and not really learning about what's the best practice for the patient, to streamline things for you as a physician so you can spend the most time with your patient and really develop that relationship and provide them the best care. So our mission is to create a coalition of not just medical students and physicians, but healthcare workers and professionals, as well as the community who want to make the medical system better. Our goal is to make it ethically and morally just, as well as providing opportunities that are equal to all. Because a lot of, one issue I've noticed, which I myself went through, was, and one of our colleagues, Walia Ajisef, she's been trying to figure out how to quantify this in data, is there is a discrepancy in who gets into medical school in this country versus who doesn't. And there are certain demographics that are privy to getting in, or there's a lot of discrimination in certain ways. And then there's the issue of gender. Like, I faced that when I was in clinical rotations, not just abroad, but here in the US, where no one really took me seriously because I was a woman of color. And so there are so many issues that we are just kind of making this list of, and really thinking about what is the best way to approach these issues. And one thing that has been really disappointing to me is that, coming from, I've worked both in research, public health, and clinical medicine. Innovation is applauded in research and even public health. But when it comes to the practice of clinical medicine, they want to stay with the old ways. They are not as readily or eager to change.
That is fascinating, isn't it?
Yes. So for us, it's about this change, but the change for the better. And if we don't get the opportunity to try and take these risks, we probably won't ever find out if there is a better way to practice medicine, to train residents, and even to teach our medical students. And Mohamed and his group, like WAIMG, they've done a great job of showing how you can take those risks and implement sustainable and very, advantageous bills within the state that have helped bridge the gap in not just the number of physicians working and practicing, but also in the gap in care in these really underserved and rural communities that need that type of care. So, so it's very hard right now to simply state what we're doing with ASP, and it's really a part of our growing pain as a new nonprofit. But our main goal is this coalition that allows everyone the opportunity to practice medicine and to get the quality education and training required for it, and to provide a service to these communities that are so desperately needed.
I'm going to have to say that I think that you are two of the wisest young people that I have run across in a long time. And it certainly sounds to me as if you have your eyes on exactly the right target or targets. And it really gives me a really good feeling to know that there are young people like you who have A, that kind of wisdom, and B, the motivation and the intensity of motivation to go ahead and get the job done. So I'm really looking forward to seeing what you guys are going to do. And I'll have to tell you that we're about to give birth to a companion program for Prescription for Success. It's called What Have We Learned Today, where we like to expand on the topics that we've talked about here. And I hope that you'll plan to be with us on that, because this is a huge subject and it needs a great deal more time than we've given it today. And we'd love to be able to give you a platform. But at this point, I am going to give you a little more time, and we're at the part of the program that I like the best. And that's when I close my mic and get out of the way and let you people speak on your own. So we'll begin with Dr. Henna Sawhney. I'm going to be quiet while you give us your prescriptions for success.
All right. So my prescription for success. I think one of the biggest things that has shaped myself, and that I think really is what is profound and special just to us as human beings, is being able to help others. There's this ideology in India called seva, and it's about being of service to others. But it's an altruistic, like you're not doing it for anything in return. It's just from the good of your heart. And that's something I've taken to, that's kind of been my motto in life, is to do seva for others. And I think that is something that really is important, especially nowadays. Doing what's good for not just you, but the community around you, making that change around you. I was fortunate enough that in high school I had a little stronger foundation, you could say, than my peers in high school for my education prior. And my high school was very low income, and I felt like I wasn't challenged enough. And I would kind of complain, as a 14 to 15-year-old, saying I'm bored in school to my the principal, and say I want to be challenged more. And while they did provide a lot of resources for me, one thing he said was that instead of just thinking about lifting yourself, think about lifting those around you. And that's really what seva is, encompasses as well, is providing service and doing service for yourself and those around you and building up together. And that's what I feel is really important about medicine, especially right now. It's not about competing with your colleagues. It's not about being the best doctor just for yourself. It's about this higher calling. I mean, we take the Hippocratic Oath about doing the best for the patient and doing the best for those around you. And I think that's very important. But even though you are of service to others, to make sure that you're checking in with yourself. That's something I neglected a lot of time. And I feel I should have listened to a lot of my, especially my medical school professors and the attending, saying that this is the time to rest. Make sure you're taking care of yourself. Just like they say on an airplane, put the mask on yourself before you help others in an emergency. And that's very true. The last thing I would say is don't be afraid to take risks. There is nothing in this world that really is set in stone. Everything can be changed for the better. And usually your gut feeling is right compared to others. I've never been someone that's fit into boxes or what typically people see. I've always found another way to reach my goal, whatever obstacles are in there. And I think this really stems from my parents because, I mean, they came here as immigrants with almost nothing to their name, and they've built a life for my sister and I. And one of the things I was really struggling with when I didn't get into residency was that I was failing all their hard work. And so being able to find another route where I can be happy and succeed on my own terms. Because what my mom always says is that nothing succeeds like success. And success is how you define it. So overall, just my prescriptions for success is be of service to others and yourself. Take care of yourself. Don't be afraid to take risks. And define your success yourself. Don't let others define it for you.
Well, thank you, Henna. A lot of wisdom packed into all that, and we appreciate you sharing with us. And I'm going to move on to Dr. Mohamed Khalif and your prescriptions for success.
Yeah, well, I think my prescription for success is going to be very similar to Henna's prescription. And I've struggled with one thing ever since I got into this whirlwind of different issues and, problems. Because success for me was always about, becoming a licensed physician and, getting into that room with the patients that you want to serve and, changing people's lives, sitting down with family, and, helping people become more healthy, being a community leader. And the only way I saw that, to get to that point was, this, residency system and the problems that I went through. And I struggled with this, word for a long time. Success, is it that? And once I took a different route, and said like, hey, I want to take a different route other than the match. And now I want to become a nonprofit leader and I want to become an advocate for this. I realized in that moment that I defined my own success. And, my biggest prescription is that define your own success. Don't be forced to live in society's version of success. And a lot of times, that's the case. And that was the case for me as well. I always lived in a society's version of success. I never had a definition of what success looked like for me. And everybody needs to prescribe their own success. And sometimes that involves risk, as Henna said. And risk can be scary. It can be uncomfortable. And it can be something that we do not run to all the time. But I think, we need to experience fear. I think we need to experience uncertainty, and we need to put ourselves in situations that are uncomfortable to be successful, because that's it. That's what it takes to be successful. I mean, if somebody if you don't like your job, I think you should take that risk. If you don't like your employer or administrator breathing down your neck, if you want to open up your own practice, you might not open it up today, but you can make the building blocks. You can start one day at a time, right? You can transition to a part-time job and try to run your practice on the side. And I love this book. My next prescription for success would be this book by Carol Dweck called Mindset. And she talks about the concept of growth mindset, which is really, I love that book. That book changed my life. And I would recommend that book to anybody listening because it is so, valuable. Some of the things that she talks about on mindset and growth. And my last prescription for success is find others, right? And whether it's just, reaching out on social media. And today we're very fortunate because we're all so connected through social media and other platforms. And it's very, easy to find people in the same boat. Like, I found Henna. I was very fortunate enough to find an amazing friend like her, and a co-founder that, has helped us reach the potentials that, we might have not reached, and other co-founders of ASP as well. And there's this famous saying in Africa, which is, go fast, go alone, go far, go together. And if you want to go far, find other people and like-minded, so you can reach that point. So, and to summarize, my prescriptions for success is 1, define your own success. 2 is be uncomfortable. 3 is read that book, Growth Mindset by Carol Dweck. And the 4th is find others. So those are my prescriptions for success.
Well, Dr. Mohamed, Khalif, and Dr. Henna Sawhney, I thank you so much for sharing your wisdom with us today. And you are both very wise, particularly for your years, and we're honored to have had you. Before we go, I want to give both of you an opportunity to let people know where you can be found and how they can follow you in whatever way you wish to be followed. So we'll start again with Henna.
Thank you. I first want to thank you for giving us this opportunity to speak about this issue and really appreciate what you're doing with Prescription for Success. And we are very excited to collaborate with you and anyone else. So you can find our organization, American Society of Physicians, at asphysicians.org. We have a Twitter as well, and it is ASP__ORG. We have about 1,800 followers, which we're very excited and hoping to collaborate and expand our platform with them. You can find myself at Henna, HENNMD on Twitter. You're also welcome to add us on LinkedIn as well. We have a page for American Society of Physicians as well as our own. And to learn more about our organization, definitely see the website, since we have a lot of information on the events we've done, our other co-founders and the work they've done, and our collaborators. And we will also be attending the Free to Care. Mohamed and I will be attending the Free to Care conference in Austin on from September 15th to 17th. So if anyone is there and either would like to attend or would like to meet us there, please reach out, and we look forward to that.
Outstanding. And Mohamed, anything to add?
Yes. So you can find my Twitter handle. My Twitter handle is @Prez and WAIMG. So Prez is P as in pencil, REZ, Prez, WAIMG. And you can find us on our website, asphysicians.org. And I'll also be at the conference with Henna, and I'm excited to meet anybody there. So that's all I would add. Thank you so much again for inviting us to this podcast. We're very honored to share our story and have your listeners listen as well. Thank you so much.
Well, Dr. Henna Sawhney and Dr. Mohamed Khalif, thank you once again for being with us on Prescription for Success. Thank you so much for joining us today. We'd really appreciate a review from you, and a 5-star rating helps give our podcast much more visibility, and that helps us reach more listeners. Exclusive content is available on our Patreon page, including membership-only material like personal rapid-fire Q&A sessions with our guests. To be sure you never miss an episode, visit our website at rxforsuccesspodcast.com to subscribe. And while you're there, learn how to get CME credit from CMify just by listening. Special thanks to Ryan Jones, who created and performs our theme music. And remember, be sure to fill your prescription for success with my next episode.